Today I am going to perform administration of inhaled medication for my patient. Before that I will see for the scenario. Once I have done with the scenario, I will send for the scene is safe, free from any spillages, cords, cables, cutters that may cause harm for me, my patient and others. Once I have done with the scene safety, I will go ahead with the hand hygiene, adhering to the 5 moments of hand hygiene by WHO, that is before and after touching the patient, before any aseptic procedure, after touching the patient's surroundings and after exposure to any body spillages. For that I will take a palm full of product and I will make sure that it will take 20 to 30 seconds, starting with palm to palm, back of my hands with the finger interlace, palm to palm finger interlace, back of my hands with the fingers interlock, rotation rubbing of tip of my fingers opposing palm, vice versa, rotation rubbing of my thumb, vice versa, rotation rubbing of my wrist, vice versa. Once I have done with my hand hygiene, I am ready to approach my patient in a professional and calm manner. Hi, my name is Sini. I am the nurse attending today. How would you like to be called?
You can call me Bob.
Okay, Bob. How are you feeling today?
I'm alright.
Are you warm enough?
Yeah.
You can see me and hear me clearly. Okay, Bob, if you don't mind, can I close the doors and windows to provide you privacy and dignity?
Okay.
Closing the doors and windows, quick hand hygiene. Before proceeding, can we have a quick identity check?
Of course.
Can you just tell me your full name, please?
Yeah, it's Bob Jones.
Okay, your date of birth?
It's 5th of 8th, 1990.
Okay, can you just tell me your address, please?
It's 6th Street, Worthing.
Okay, are you allergic to any kind of medication or food?
No?
Okay, thank you for information, Mr. Bob. Okay, Bob, the very reason I am here to administer you an inhaled medication, that is salbutamol. It is to ease your breathing and open your airway. So, as this is the medication, it has a side effect. You may feel dry mouth as well as palpitation, but don't worry, I will be here to monitor you for 30 to 60 minutes after the procedure. Is that all right for you? Okay, so in this procedure we are using a aero chamber that I will explain you how it will be using for you. Is that fine?
Yeah.
Okay, are you comfortable enough?
Yeah.
Are you still want me to continue with the procedure?
Yes, please.
Okay, so I will prepare the materials for the procedure. In that time, if you need me, just shout, I will be in the other room. Is that all right?
Okay.
Okay, now I am going to prepare my materials for the procedure. So for that, first I need a tray that is clean, dry and disinfectant last 24 hours. Necessary it is safe for me to use. Okay, next an aero chamber that is clean, dry and actual setting. It should be in a box with expiry date, and I will make sure that it will not be crossing the opening date from 12 months, and it is necessary it is safe for me to use. And the medication, that is the salbutamol inhaler. So it is clean, dry and intact, and within the expiry date of 2024 it is safe for me to use. As this is the medication, I have to counter check with my prescription. So it is salbutamol 100 mg per puff. The order is 200 mcg. So I have to give the patient 2 puff. Do at my date and do at my time. There is the prescriber's name as well as the signature is there. So the prescription is correct. As I am dealing with the medication administration, I have to follow the rights of the medication administration, that is right drug, right dose, right route and method of administration, and right date and time of administration, diluent if applicable, and allergy check. And I will check for the prescription, it is legible, valid, and the prescriber's signature is there. If any of this is missing, I will not administer the medication. I will escalate this to the prescriber, and if I need any kind of further clarification regarding the medication, I will follow the British National formulary. And next I need 2 alcohol wipes, that is clean, dry and intact within the expiry date of 2024. It is safe for me to use. Now I am ready with my materials. I will approach my patient now. Okay, Bob, I am back with your materials. Are you happy?
Yeah.
Okay, so before proceeding, can you just restate your full name, please?
Yeah, it's Bob Jones.
And your date of birth?
It's 5th of 8th, 1990.
Can you just tell me your address, please?
It's 6th Street, Worthing.
Okay, it is good that you are sitting in the upright position, because it is a better position to have a good expansion of your lungs, and you are already placed one pillow behind your head. It will help to tilting your head forward and backward. Is that all right for you? Okay, shall we proceed with the procedure now? First, I will introduce you this aero chamber. There it has a mouthpiece that I will put to your mouth, and there is a chamber. It will help to equally distribute the medication to your lungs, and the other part it will be connected to your inhaled medication. Is that fine for you? Okay. Before the procedure, some instruction is there. That is, before the medication administration, you have to take a couple of respirations. While your second exhalation, I can connect this mouthpiece to your mouth, and after having these medications, you can have a 5 set of normal respiration, and after the final respiration, I will remove the mouthpiece and you can exhale through a purse lip. Is that all right? Are you all right with my instructions? Okay. So now I will take the medications for you. I will take off the cap and I will open the mouthpiece for my patient, and I have to for the medication I have to shake it for 2 to 5 seconds. 1, 2, and I will connect it with the chamber. Okay. Okay, Bob, can we have the first set of respiration? Okay, inhale, exhale, inhale, exhale. Seal it with your mouth to mouthpiece. Okay, and can you just tilt your head backward? I am going to press the canister. Okay, can we have 5 cycles of respiration? Inhale, exhale. 1, 2, 3, 4, 5. I am going to remove, and you can exhale through a purse lip. Is that all right for you? Okay, so I have to give you 2 puffs. So can I go with the second puff? Okay, so I have to wait for 30 to 60 seconds if this is the same medication. If a different medication, I have to wait for 2 to 3 minutes, and before the second puff I have to remove the canister and I have to shake for 2 to 5 seconds. 1, 2. Now I will connect it again with the chamber. Okay, Bob, shall we have the set of respiration now? Inhale, exhale, inhale, exhale, mouth to mouthpiece. Seal it with your mouth and I will press it. Can you just tilt backward your head little bit? Okay. Now I will press the canister. Can we have a 5 cycles of respiration? Inhale, exhale. 1, 2, 3, 4, 5. Okay, I am going to remove. You can have a purse lip exhalation. Are you all right now? Okay, so we have done with the procedure, and don't worry, I am here to monitor for 30 to 60 minutes. So if you have any kind of side effect, you can let me know. Can you just give me a couple of minutes for the documentation of the medication? Okay, so I will keep it over here. You can rub. I will do my documentation with my full name, signature and date and time of administration. Okay, Bob, we have done with the procedure, and if you have any kind of clarification that I am aware of now. Okay, so if you need me, just shout. I will be in the other room and I will do my aftercare. Is that all right for you? Okay, and I will leave the aero chamber with you for the next use. After I will cleaning with the soap and water. Is that all right for you? Okay, and I will place the inhaled medication near to you, and whenever it is needed, you can use it also. Is that all right? Okay. So I will do the aftercare now. So everything that touches the patient, that will go to the clinical waste bin, and the aero chamber will be cleaned with the soap and water or by the manufacturer's advice, and I will leave it the patient side. Okay, Bob, now I am leaving this aero chamber in your bedside. When you are using, and after using, you have to wipe it with this alcohol soap. Is that all right for you? Okay, now I am going for my aftercare and final documentation. Is that all right? Okay, so the tray will be disinfected for the next use, and I will do my final hand washing and final documentation.